The American healthcare system can be confusing, even for people who have lived in the United States for a long time. Like many things in the U.S., the system is based on individual responsibility. Keeping healthy means regular doctor visits for every member of the family. But individual responsibility means you have to make and keep your own appointments. In this way, Americans see themselves as partners with their doctors and nurses. Healthcare workers actually expect you to ask questions so you can understand how to be responsible for your family's health. Central Maine Medical Center, also known as CMMC, is trying to make the healthcare system easier for new residents of Lewiston and Auburn to figure out. There are 5 basic ways to access healthcare and information at CMMC, and in this video, we'll look at each of them. The International Medicine Clinic, your family doctor, the emergency department, home care, and the library. But no matter which of these you use, CMMC wants you to get the healthcare information you need. The hospital offers interpreters to make this possible. Just ask.
May I help you?
Yes. Yeah, maybe
You need an interpreter?
yeah, Somali.
You need a Somali interpreter?
Somali, please.
Okay.
Yes.
At the International Medicine Clinic, our job is to help you get started with the health services you need. Mr. Ahmed called CMMC, asked for the International Medicine Clinic, and made an appointment in advance.
Ahmed.
You have an appointment today?
Appointment today, yes, 9 o'clock.
The clinic's cultural broker is knowledgeable in the customs of different countries and will help with the Ahmed family's orientation. Today, Tuesday, they receive their complete health checkup. Each family member is interviewed about his or her medical history, and they each receive lab tests. The Ahmed family will be asked to return on Friday, when the doctor will have the results of the tests.
Hello, I'm Dr. Nagraj.
Hi, I'm
Hassan. Mohammed. Hello, I'm Dr. Nagraj. Hello.
Now, on Friday, the doctor can have a complete discussion with the Ahmeds about their health. If needed, he will make referrals to other doctors or social service agencies, for instance, to get help with heating fuel or childcare. The doctor expects the family members to stay until they understand how to follow up on this visit and exactly what the next steps are. They ask many questions.
Okay, since my son is sick today, are you gonna give him a note to excuse him from his school, or I should send him when he's feeling better?
I will be happy to give him a note, but once his fever calms down and he stops having the runny nose and he's eating and drinking okay, he can go back to school. So I can give you a note that says that he can go back to school.
The doctor and cultural broker are happy to answer the family's questions.
Okay,
The International Medicine Clinic will set the family up with a doctor for their future health care. This doctor is called the primary care doctor, or the family doctor. From now on, the Ahmeds can make appointments and go directly to this doctor. This is the second way into the healthcare system. Some people simply make an appointment with a doctor. Because Aziza is unsure of her English, she has asked her caseworker to call her doctor for an appointment.
Okay, 3 o'clock. That sounds good. Thank you.
Okay.
The doctor's office will expect Aziza to be on time for her appointment, and if there's a problem, to call and change the time or cancel. Once again, if needed, an interpreter is important because Aziza will be expected to understand what is happening during the visit. However, the interpreter may be helping over the phone instead of in person.
How long has it been there?
Week.
1 week. Is it painful? Okay. Is it itchy? Okay.
Often, having someone write down the names of illnesses, medicines, and doctor's instructions can be useful. Whether you're able to read it or not, you can have it with you to show other doctors, pharmacists, or family members. Yes, there it is again. If you don't understand something, just ask. This primary care or family doctor looks at the whole picture of your health, but often a specialist is required for specific areas of the body. If necessary, the family doctor will refer you to a lab for tests like x-rays or blood tests, or refer you to another doctor, for instance, a gynecologist, obstetrician for family planning and women's health issues, a cardiologist for heart-related care, a pediatrician for children's health care, or a psychiatrist or counselor for mental health help. After moving to a new place, people often feel a great deal of stress, depression, and anxiety. In the American health system, mental health is treated just the same as physical health, so doctors will treat mental and emotional problems if you ask for help. When there is an accident or an emergency, dial 911 from any phone. You will be connected to emergency services, and an ambulance will take you to the emergency department. For smaller emergencies, when you still need to see a doctor right away, you can go directly to the emergency department yourself. At the hospital emergency department, you will be asked to check in and offered an interpreter.
So, bring your arm close to your body. Good.
You will see a doctor who may refer you to someone else for more help, or if necessary, you may be admitted into the hospital. In a life-threatening situation, family members may be asked to wait in another room while doctors work on the patient. Even though people are busy, don't be afraid to ask questions so you'll know what to do for follow-up care.
He's wondering if the sling get wet.
So you don't want to get the sling wet. You want to make sure he takes it off when he takes a bath or when he sleeps tonight. He should only wear the sling.
Often after a doctor visit or hospital stay, you will be given instructions for home care and medications to take. It's extremely important to follow the dosage and the doctor's directions, even if you feel better. Many medicines, like antibiotics, are given as a series that can last a couple of weeks. If you stop the medicine too soon, the disease can come back even worse. If you feel like the doctor gave you a medicine that is not going to help, it's best to talk to the doctor so they can change it. When at home, especially for elders living alone, it can be a lot of responsibility to take care of your own health. Many people feel isolated taking care of young children or elders who are sick.
How are you? How are you feeling today?
Fever.
Home health care may be available to you in your home. Just ask. Often the words used to describe medical conditions can be difficult to understand, even in the same language. For that reason, CMMC has a reference library with free materials for all.
Ma'am, can I help you?
Library.
Excuse me?
Library.
The library?
Library.
Okay.
For that reason, CMMC has a reference library with free materials for all. The library has the latest information on diseases, treatments, and medications. The librarian is happy to help you find information that can be used right in the library or checked out to bring home.
Somali? Yes, we have some information in Somali.
Library here?
Yes, library's here.
If you need an interpreter, just ask the librarian.
I can call and get an interpreter. I have some more information on heart disease that might help your mother.
Waxaan ku helay aan ku hayaa faahfaahin dheeraad ah oo ku saabsan caafimaadka iyo wadna qabadka oo hooyada caawin doona.
The collection includes many audio and video materials in different languages. The whole family is encouraged to use the library to find information, whether it's women's conditions or simple materials that help children understand medical issues.
And if you need more information, that is my name and telephone number and way to contact me.
haddaad macnaha u baahan tahay faahfaahin dheeraada ama wax kaloo dheeraada kaarkan adiga iskale magaceeda ku qoran telefoonkeeda ku qoran sad ula soo xiriirida dhan baa ku qoran
Okay.
Here at Central Maine Medical Center, we want you to get the information and medical attention you need, whether you access CMMC through the International Medicine Center, your family doctor, the emergency room, or at home. When you require additional help, the doctors will refer you to specialists, or you can always get more information from our library. It is our hope at CMMC that everyone in the Lewiston-Auburn area will take advantage of our medical services to stay healthy. Remember, to become a partner in taking care of your family's health, all you have to do is ask.